Have you ever felt excessive worry or fear that interferes with your daily life? You're not alone. Anxiety, a common mental health concern, affects people of all ages. It's normal to feel stressed or uncertain at times, but when anxiety becomes excessive and persistent, it can disrupt daily life and overall well-being. In this video, we will explore the signs and symptoms of anxiety in children and adults, how it affects individuals, and the importance of seeking help. And anxiety in children can show up differently than in adults. You might notice them worrying excessively about everyday situations like going to school or what's for dinner. They may avoid certain places, people, or activities that make them feel uncomfortable or scared. Difficulty in concentrating or focusing on tasks is another sign. They may seem irritable, restless, or have trouble sleeping. Physical symptoms such as stomach aches or headaches are also common. Some children may become overly clingy or show signs of separation anxiety, like crying when a parent leaves the room. They might also constantly seek reassurance or approval, always asking if they've done a good job or if you're happy with them. These signs are more than just childhood fears or a phase. If they persist and interfere with a child's daily functioning, they could indicate an anxiety disorder. Remember, early recognition can make a big difference in managing anxiety and ensuring a child's well-being. Anxiety in adults can present itself in various ways, both mentally and physically. It's not just about feeling worried or fearful. Anxiety can make its presence felt through persistent, excessive worry about everyday situations. This worry can be so powerful that it becomes difficult to control. Restlessness or feeling on edge is another common symptom. You might find yourself unable to sit still, or a sense of unease may constantly nag at you. Difficulty concentrating or your mind going blank can also be a sign of anxiety, as can disturbances in your sleep patterns. Physically, anxiety can lead to symptoms like muscle tension, a rapid heartbeat, or even sweating. Some people might avoid certain situations or activities due to their anxiety. In more severe cases, anxiety can trigger panic attacks, which can include intense fear, chest pain, and shortness of breath. Remember, if these symptoms are severe, persistent, and interfere with daily life, it may be a sign of an anxiety disorder. Anxiety can significantly impact an individual's life, leading to decreased quality of life, strained relationships, and difficulty functioning at work or school. It's like a domino effect. One area of life gets disrupted, and it can easily spill over into other areas, creating a chain of distress. Now, let's delve into the realm of clinical research. Anxiety isn't just a figment of one's imagination. It's a complex disorder, a convoluted web spun from a combination of genetic, environmental, and psychological factors. Imagine the brain as a bustling city with neurotransmitters as the traffic. Research suggests that anxiety can be linked to changes in this brain chemistry. It's like a traffic jam, causing delays, confusion, and stress. Genetics also play a pivotal role. Just like how you might inherit your grandmother's curly hair or your father's love for jazz, the risk of developing anxiety can be passed down through generations. Then there's the environmental aspect. Stressful life events, whether it's a major life change or a traumatic event, can trigger anxiety. It's like a seed planted in fertile soil, sprouting into a towering tree of worry and fear. Lastly, let's not forget the psychological factors. Negative thought patterns can amplify anxiety, turning molehills into mountains in the mind's eye. But amidst this whirlpool of worry, there's hope. Effective treatment options include therapy, medication, and lifestyle changes such as exercise and relaxation techniques. These are like lifelines thrown into the swirling waters, helping individuals navigate their way back to calm shores. If you or your child are experiencing symptoms of anxiety, it's essential to seek help from a mental health professional. It's important to remember that anxiety isn't a sign of weakness or something you should be expected to just get over. It's a real complex condition that deserves understanding, compassion, and professional treatment. You don't have to face anxiety alone. There are countless resources available to help you navigate this journey, from therapists and counselors to support groups and online communities. You can find the help you need to manage anxiety. With the right support and treatment, it's possible to manage anxiety and improve your overall well-being. Taking that first step can be the hardest, but it's also the most important. Don't let anxiety control your life. Take the first step towards managing your anxiety today. If you found this video informative and helpful, please like, share, and subscribe to our channel for more content on mental health and well-being.